them all down into one word, that word would be community. It would be the recognition of our deep interconnectedness.
In the context of well-being, I feel like there are indicators of how like poverty from the fear that is being distributed. Like if we are, we've discussed so far in this conversation that fear in our mental health can affect our physical health. So for a lot of people, they're scared about not being able to pay their rent or not being able to buy food. And some of the research that we were doing going into this is like, well, how many people in the world actually have the kind of safety net that they have in places like Denmark?
This current situation is affecting the people who are making the policies to stay home and isolate, to have comfortable places to do so. It's a very different reality for people who don't have that luxury. So if we have the time to, I think that's where you were headed, or you were also pulling that point in. I think that's an important point to address if someone has something that they would like to share on that point.
I'm thinking about the reality of social distancing. Jennifer, you had an original question, about that. Like, how are we managing that? I mean, but the equity of it, like, how can we really ensure nobody's left behind? I mean, that's our mission, right? We want a world that works for 100% of humanity. What if we made that our driver? And so, I'd love to invite Ashok and Jennifer, because you're living in communities where there's generally more density in the housing. I mean, I think, and Sonia, and, Roman, you're working in Latin America, and, but like, I'm just wondering, like, Ashok, from our time in Nepal, I'm just wondering, like, how relevant are these measures? And, could it be that the deaths of the economic changes, like, how much could those hurt people? And, where do we need to start, really considering the economic impacts on health?
I just want to reply the question of Deepak Khatiora from the first one, right? He was talking about the mental health is one of the biggest issue over here in Nepal and everything. Yeah, it's being a mental health is being a big issue over here these days, right? Because nobody's allowed to just come out from the home. And people have the limited earning, right? And Nepalese people, they have very less per capita income and everything. And what I suggest to many people is like, when you expect something and when the expectation you don't have, you know, you don't fulfill the expectations, you have like this, some kind of frustration and everything. The frustration, it leads to depressions, and depression is a mental health, right? So what I suggest to people is like, in this pandemic time, Nepal, we are in the second stage of pandemic. In this pandemic time, you should not like have more expectations. You should have only expectations like a basic needs. I'm talking about the Nepalese context because uh, uh, Nepal, we are not the very developed countries that you can compare with the US, or let's say Australia or UK or some other European countries or American countries. We should think about the ground fact reality of Nepal, how Nepal is, what's the per capita income, what's socioeconomic conditions and everything. So what I suggest people is like, you should not have more expectation. You should expect only some basic needs in these times, because government, they are trying their very level best, to provide all these healthcare facilities, this fooding and everything. Government, they are doing, right? Even what in Nepal, what's happening is like, even in the war level, I said local government or the central government, the federal, they are providing all these foods and everything for these laborers and everything who don't have the high income, right? So if you don't have more expectations, then you will surely have very good time,
We have this situation, this pandemic has forced us to really rely on these technologies, but what a valuable resource they are at the same time that we are able to connect in this way. For our call to action, we'd like to invite all of you to go to our Facebook page, to the Global Summit Facebook page, and just share how the current situation as horrible as it is, what are the opportunities to meet the needs that have arisen as a result of the current situation, drawing on these resources we have from technology, drawing on what you see as a way to bring about positive action. And yes, definitely, if you have an idea for something that you think would be beneficial on a local level that you think could come from the global summit, please definitely share that. We invite you to share those ideas. Thank you so much.
Thank you very much.
Stay home. Take care. Thank you very much, Melanie.
Hueva demonio. Thank you so much.
Thank you very much.
Thank you, Sonia.
All right. So everyone out there, thanks for joining this little extra time. It's a very rich conversation and good to kick off with Wellbeing 360. So whole health from the inside out. Here we come, world. Mwah. Signing out. Sayonara. Arigato gozaimasu from Tokyo.